Hello, have you seen this news? Have you seen this headline? This judgment from Delhi High Court? What does it say? It says that a patient died after transplantation and then it was done in a saloon, that it was done by people with no medical background and no care was given to the patient, and court has asked for severe action, strong guidelines and control and regulation of who can do transplantation, where it can be done, etc. And I am here to talk to you about this issue, what has been called black marketing of hair transplantation, quackery in hair transplantation, ghost surgery in hair transplantation. I am Dr. Venkataram, hair transplant surgeon, Venkat Center for Skin, ENT and Plastic Surgery, Vijayanagar, Banshankari, Cunningham Road, Bangalore, to talk to you about this in this video. Death in transplantation has happened, and I have spoken myself in a couple of videos earlier. There was a case of HT which died in Chennai some 5 years back. There was a death in Barcelona due to an allergic reaction. There was a death in Mumbai, and there was recently, a month or two back, there was a death in Patna, and now this. It is a matter of surprise. Why should death happen in what is supposed to be a simple daycare, local anesthesia surgery? And what happened in this case? This case, a young man has gone to a particular clinic which is called a hair studio. There he has been seen by 2-3 people. This patient has agreed to undergo transplantation for some 30,000 rupees. Transplantation has been done. Then he has developed severe headache and pain, after which he developed what appears to be septicemic shock, a severe infection everywhere in the body. He has been admitted Fortis Hospital, Escorts in Delhi. He could not be recovered and then he died. This was complained to police, who did not initially seem to have taken any action. Then it landed in the court, and after about a year or so, the court has given its judgment. Now, during the court hearings, it was found that 3 people were involved. Couple of people had fled. Ultimately, they were caught. And the court's findings are as follows. Pay attention to this. 1, this was like a saloon. The surgery was done in what looked like a saloon, not a medical establishment, no proper theatre. Number 1. None of the people who operated had any medical background. They were not doctors, they were not nurses, nothing. Ordinary people, laymen, and they did surgery. And number 3, there was no license, there was no clearance, there was no certificate. And the court was shocked. How can these things happen? That too a surgery. And there was no post-operative care available because they didn't have any ability to take care of the case. They in fact ran it. Why is this happening? Simply because this field has become too commercial. People think it is very easy, everybody can do it, and everybody is trying to do it. And secondly, they are compromising on safety and quality, trying to do it in spas, trying to do it in saloons, etc. The case in Chennai had occurred in something like a spa. Case in Patna was similar. Now this is also similar. Now the important thing here is to note that this is a surgery. It has to be signed by qualified people. Qualified people will not only have the necessary expertise and training to do the surgery, but also to make sure that every safety precaution is taken. All guidelines are followed. Biomedical waste disposal, pre-operative checkup, proper counseling, proper documentation, proper anesthesia, asepsis, before, during and after surgery, proper post-operative care, handling complications if anything happens. all these will be taken care by the qualified doctors. But if it is a quack who doesn't have any medical knowledge, this is what will happen. So, this is why different associations such as Association of Hair Restoration Surgeons in India, International Society of Hair Restoration Surgeons have been advocating the proper safety measures and proper qualifications. ISHRS has initiated a program called Black Marketing in HT. Fight the black marketing. AHRS has initiated Avoid Ghost Surgeons issue. Somebody comes, operates, disappears. You can't even track it, just like it happened in this case. And these people are doing it often at very low rates because they don't have to have a theatre, they don't have to have proper instrumentation, they don't have to have anesthetic facility, they don't have to have resuscitation measure, they don't know any of this. But when something goes wrong, it goes wrong badly like this. A person has paid with his life all to save a few thousand rupees, landing up with cracks. This is not done, this is not fair, it should not happen. Now, so what needs to be done? One, at the patient level, please go to a trained, qualified doctor, dermatologist, plastic surgeon, head and neck surgeon, such people. Make sure that they have a proper setup and they are from your city, they are not flying in somewhere. Make sure that they have the necessary expertise and training. And the doctors should ensure that they have all the necessary protocols in place, equipment in place, resuscitation measures in place. Everything has to be done as per the guidelines. There are several guidelines by associations. Dermatology Association has done, hair restoration surgeons have done the protocols. These will all ensure safe surgery. Surgery has to be safe because a hair transplant patient is not really a patient. He is a healthy person. He comes in healthy, he should go out healthy. So these are minimum that is needed. But there is something more which has to be done, which the court has pointed out. Court has said the government should take notice of it because such clinics are mushrooming. Such quacks are mushrooming. So court has called upon the government to lay down proper guidelines, proper regulation mechanism, proper supervision mechanism to check that these things are run in the proper medically authenticated manner, and if anybody is found, such clinics are closed. We are appealing to the government, our associations are doing it, and hope that government will take note of this. Otherwise, precious lives will be lost. So, my final suggestion, recommendation, advice, please be bothered about safety precautions. Money is not everything. Good quality care needs money to be spent on such good quality care. And in a cosmetic surgery, quality cannot be compromised. You cannot accept less than acceptable standards. So be careful, go to the right doctor. We at Venkat Center, we have dermatologist, hair transplant surgeon and head and neck surgeon. We have all protocols in place. We call an anesthetist wherever needed for such surgeries. We have every single resuscitation equipment, including a defibrillator, oxygen supply, everything, and make sure that everything goes well. In over 22 years of practice, I can tell you that we have not had a single serious complication of any kind. This is something which I can tell with pride, and this will be the case with most doctor-run centers. They will ensure this. So trust your doctor to do the surgery, trust your qualified doctor to do the surgery. Take care, be safe. I hope you have liked this video. If you have any more topics that you want us to discuss, please give us the feedback. Please share this information, tell your friends, and visit our website for details, www.venkatcenter.com. Thank you.